All right. Hello, everyone. Enjoying your lunch. Thank you for listening to me. I'm here today to talk a little bit about the work of Rose. And so, those of you who are here are probably pretty familiar with Rose. But I feel like I have a great inside view because I work as their external evaluator. But as an evaluator, I work with a number of nonprofits. And Rose is really a unique organization and quite impactful. And I say that because when you interact with nonprofit organizations, they typically work on a specific level, right? They'll work with individuals, they'll work with families, or they may work at the policy level, right? But Rose is an organization that does work on all levels. And so my background is in community psychology, which deals with social change. And what we learn is when you want to influence change, you have to work simultaneously at all levels. And while a lot of organizations coordinate to work at all levels, Rose does the work at all levels. So I want to take a moment to give kudos to Rose and all the hard work that you all do. And so not too long ago, a couple years ago, Rose released the blueprint of Black breastfeeding. And since a few of the recommendations in the blueprint were around research and around policy. And so, as you all know, Rose works, again, at all levels. And what makes them nimble and what makes them able to do this influential work is they listen to all voices, not just the expertise of the people in academia or the people at national organizations, but they value the expertise of the lived experience. And so in order to do the work of policy and research, Rose moved in that exact same vein, listening to the voices and valuing the expertise of all people. And so that's what I'm going to talk to you a little bit about today, is the work of the state of Black breastfeeding. And so, again, as I said, Rose recognizes the importance of utilizing collective knowledge and building on previous work to achieve new impacts. And so, as a result, what Rose has done is they created a BIPOC-led space. And when I say a BIPOC-led space, it's really important that, we lift that up, because while it's important to always have all voices at the table, when you come to a space of generating knowledge, it's always important. Rose values the importance of having the people of the lived experience lead the work, okay? And so Rose created this BIPOC-led space in which ideas can be activated to increase and improve rates and the experience of Black breastfeeding. And that became known as the State of Black Breastfeeding. And so this initiative's goal, as I said, is to improve breastfeeding initiation and duration rates in Black communities by prioritizing and amplifying the voices of perinatal Black families, community health workers, organizations, and healthcare providers. What we did was we had two convenings. The first convening was last year at the Rose Summit, and we brought together all of these stakeholders, and there were a total of 42 stakeholders that we brought together, and we talked to them about how their experience could really influence a policy and a research agenda. And so in order for us to do those things, what we did was we had several conversations in the room. And so we had people to think about these discussion questions. We asked them to think about what are things that we think that science and the general public need to know about Black breastfeeding. What do they need to understand? What things have you heard from your peers or people that you serve that need to be researched? What are things that are being done well or are being done poorly that need to be investigated? If you did breastfeed your child, what would you do differently? What were the facilitators? What were things that detracted from your experience? We also asked them, if you didn't breastfeed, why did you choose not to breastfeed? And what would you do to change that? if you had to do it again? And so from those questions, we had a number of facilitated conversations in the room around those questions, and it generated 300 responses. And again, as I said, these are families in the room. And when I say families, I mean moms, dads. We had researchers, we had lactation support providers, we had people who ran the gambit. And so they answered these questions and generated around 300 responses. And what we did was we conducted a thematic analysis. And from that thematic analysis, we came up with 35 research questions based on those responses. And then once we came up with those, they were under 4 different headings. We aggregated them under 4 headings. One is education and information, equity and policy, community support and resources, and clinical and healthcare systems. And so 35 research questions is still a lot to put out into the general public. So what we did was we had another convening where we asked folks to help to prioritize what are the most important research questions that we need to be asking, that we need to have researchers out there looking at so that we can lift up those responses to really improve and make change in Black breastfeeding. And from those, we came up with 14 topics. The first ones were under education and information. And so we had a total of 5 questions of the 35, and we asked our participants to prioritize what are the most important research questions under education and information that researchers need to be looking at. And so the first one is what efforts and components should be considered in breastfeeding marketing so that we can have the same reach and impact as the formula ads? What are they doing well that we need to implement? Also, what education is needed before and after delivery to assist families in setting realistic expectations for their breastfeeding journey? Because what did we find out? That many clients, many families don't have realistic expectation of what breastfeeding looks like, and they stop before they want to. Another research question we looked at that got lifted up was, are higher rates of breastfeeding knowledge resulting in higher rates of breastfeeding initiation and duration? In academia, we are taught that knowledge leads to change in behavior, but when we are in spaces, we know that that doesn't always happen. And so we need to find out what are some mediators, what are some moderators, what helps, what doesn't help, and more specifically, what do we need for Black families and families of color. Under equity and policy, the research questions that got lifted up is what local, state, and national policies promote and support and protect breastfeeding, and what's really working well in our communities, both in the U.S. and internationally. What are the most effective methods of educating the public and the business community about federal breastfeeding laws? What is the impact of paid family leave and/or earned income tax credit on breastfeeding duration? We know that these laws are enacted, but in some states they're doing really well, in other states they're not. So we need to know what the impact really is. And then what interventions are most effective in reducing and/or eliminating bias among care team members that support breastfeeding? Under the topic of community support and resources, the research questions that got prioritized were which community-based solutions have the greatest impact on Black breastfeeding? We know anecdotally, but are there any big studies that are looking at what are the components that really drive improved initiation and duration rates? What are some barriers or facilitators for longer breastfeeding duration? We know that particularly among Black people, we'll initiate, but our duration rates are shorter than other populations. And then another research questions that was prioritized is, what are the protective factors for women who continue to breastfeed in environments that are not conducive to breastfeeding? Because we know that there are families out there who are breastfeeding and enacting their breastfeeding journey the way they want to in not so conducive environments, right? And so under the last heading, it was, there were 4 that were highlighted, which is how are clinical providers supporting or undermining breastfeeding among Black women in a hospital setting? Because what do we know? If you're not supporting, then you are undermining, right? And what is the impact of breastfeeding-friendly hospitals on the initiation and duration rates of Black women? We know initiation rates are going up, but what do we know about duration? And then we want to know how clinical providers are supporting or undermining breastfeeding in outpatient setting. What are some policies that work? What are some behaviors that are working? We also wanted to know what innovations are needed to increase access to a variety of culturally appropriate and culturally diverse lactation support providers. We all know that we want all populations to breastfeed, but we want the population of lactation support providers to be diverse enough that folks can have a support provider who reflects their community. And then finally, in what ways does maternal mental health impact breastfeeding initiation and duration, as well as the experience? There's work that's happening. I love the fact that folks are starting to highlight the importance of maternal mental health, but what do we really know about how that's impacting breastfeeding rates? And so these are the research topics that were prioritized through our convenings. And so we also asked the question about what policy priorities that, when addressed, will have the greatest impact on increasing Black breastfeeding rates. We're in a really exciting time where we have an administration that has a focus on policies related to Black breastfeeding and breastfeeding in general and maternal health in general. And so now that we have this entree with the federal government, what are the policies that really need to be happening that will have the greatest impact, or the policies that need to be pushed and addressed? And so one thing we talked about was ensuring that those giving birth are not just heard, but also are decision makers in accountable systems of care, right? We know folks may be heard, but they may not be decision makers. And also, who's holding these systems of care accountable? Another priority that was brought up was creating a payment structure for all levels of lactation support providers. That's the work that's being done by Rose on so many levels, and that's the work that needs to be pushed forward for the lactation field. Providing workplace and workforce support for lactating parents. Again, the Pump Act was passed. There's so much exciting things happening in the policy landscape. How do we continue to move that forward? Providing blanket coverage for breastfeeding supplies from all insurance companies. During our meetings, we heard stories about families who had to get letters from NICU to get pumps to be able to help to be able to feed their children. Like, it should be a blanket coverage because we know that breastfeeding works. And the final three priorities were diversifying the lactation workforce through funding for lactation training programs that focus on BIPOC trainees. We know we need that diversity. Supporting the creation of spaces where Black lactation professionals learn to write policies. How do we move our thoughts into policies that can impact what's happening on a national level? And then finally, providing additional financial supplementation to reduce the wealth gap. We know that there are a lot of pilot programs that are out there that are really influencing families and giving better lives. So how do we make sure that that happens on a larger scale? And so from those meetings that we had around the state of Black breastfeeding, we now have a research agenda, research priorities, and we have policy priorities. So what do we do with that? One thing that I wanted to highlight was something that was mentioned at both convenings, which was the importance of having a BIPOC-led space. And so while it's important to have integrated spaces, in so many, it's all, when you're generating knowledge, it's important sometimes to have a space of people who are like-minded. And so I found this quote, and it says, "It wasn't until I was in BIPOC-only spaces that I realized how much of myself I had to cut off to fit into white culture. So being in people of color spaces allows me to reclaim those forgotten parts of myself." And so when we think about generating work that is going to influence what's happening for Black breastfeeding and breastfeeding for people of color, having spaces that are led by people of color is really important, because it gives people the ability to kind of relax and flow from a space of common knowledge and common experience. And so, what is Rose going to do moving forward? What was lifted up and what was asked for by the participants were a space that people can come together and collaboratively outline these policy priorities for Black breastfeeding. So the goal is hopefully to create a Black breastfeeding policy collective. We now have these policy priorities. How do we mobilize the connections that we have to begin to move these priorities forward? And so this is a space that we hope will provide education to all people on how to translate identified need into policy priorities. Some folks, when you hear, okay, we're going to come up with a policy agenda, like, okay, that's beyond my scope. But it's not beyond anybody's scope, because you have the knowledge and you have the experience. And like I said, the one thing that I love about Rose is that it's not just about valuing the people who have the degrees and have worked in all of these spaces. It's about valuing the lived experience and knowing that we are all experts in how we engage. And so creating a space where folks understand how to turn their experience into policies that influence change across the country. And so that is one amazing thing that, hopefully we'll be able to find funding to do. And even before we find funding, if y'all know Mama Bug, she gonna make sure it happens. And so, just wanted to lift up that there is power in a collective. And another thing that came up out of those conversations was having a collective of individuals who develop a policy priority provides a level of power, because at that point, when policy agendas come out, if folks know that there's a group of individuals who are specifically working in that arena, then they come to you, and then they know you have the knowledge and ability, and so you become valued. And so this is where Rose is going to be able to even have greater influence over the policy space. The second vision is to be able to collaboratively engage in research to support policy development in Black breastfeeding. Again, a lot of folks, you say research, I don't know how to do research, but you do. And research really should start from the ground up, right? It should start, because in order to make it relevant, we need to understand what's happening, because the milieu changes so quickly. And so for the Black Breastfeeding Research Collective, it would be a collaborative space that would give community stakeholders the power to influence research priorities and to investigate topics, to learn that research isn't something that's so far-fetched. For those of you who are familiar, there's a framework called community-based participatory research, right? And there's so many things that you can do to make sure that you can collect data from your space, because data is just a collective of experiences. When people hear data, they're like, oh, I don't have all that data, but you do. If you talk to all the people at your table, then that's data, right? And so when you think about it like that, that's what we want to do, is to deconstruct these words that sound like they're so difficult to do, because it's not. So in this space, it would be a space where we learn how to conduct research in a way that's reflective of our communities, and have a collaborative environment that equally values and utilizes the wisdom and knowledge of and experience of all stakeholders. And so what's the first step? One thing that we did at Rose was we came up with an index called the Rose Maternal and Child Health Risk Index. So what do we know? There's a lot of data out there. And so, people write studies using rates of breastfeeding initiation and rates of preterm birth. But who has aggregated all of those factors to create a risk index? We did. So what we did was we pulled together data points from from the black breast, so we looked at rates of black breastfeeding initiation, and all of this is from CDC. We pulled percentages of black preterm births. We looked at maternal mortality rates. We looked at infant mortality rates. And we also found this really cool index called the Maternal Vulnerability Index, which was developed by Sergo Ventures. And so what we did was we aggregated those indexes, and we looked at each state to find out, what were the rates in each state. And now I'm going to put my little researcher hat on, and we divided all the data into quartiles and all the things. But we aggregated it up to create this risk index to identify what are the states that have the greatest risk, what are the regions that have the greatest risk. Because anecdotally, we all know what's going on, right? But you can't get up in front of a room, or you can't write a grant and say, so based on what we know anecdotally, we know that there are a lot of issues in the South. Well, what is that based on? And so what we were able to do was to put together this index so we can say, yes, this is not just from one piece of data or another piece of data. We were able to aggregate all of these pieces of data. We did the analysis in a statistically congruent way, and we divided it up by public health region, and we divided it up by state. And what did we find? We find what we know, that excessive burden on individuals in the southeastern U.S., those are the states that had the highest risk scores. The Midwestern U.S. had the second highest risk scores, and then we found that the lowest risk and the best outcomes were in the Western Pacific Coast states and in the Northeastern U.S. And so now that we have that index, guess what it can do? It can guide programs, right? It can guide funding. Was it a difficult index to put together? No. And so that's what we're trying to do, is we're trying to show you the data is there. You have your data in your lived experience, and there is publicly available data that you can put together and begin to say, here are the stats that we know. And this is what we can do to influence what needs to be happening. And so we use this as our test case, and now we're using our index scores to guide the work that Rose is doing moving forward. And so, in summary, just wanted to say Rose has laid the groundwork for a collective of Black support providers, families, and researchers to lead both a policy and a research agenda for Black breastfeeding families. And I look forward, so again, my name is Dr. Kimberley Broomfield Massey, and I'll probably be reaching out to you guys because we need help in this work, and we're not going to do it without you. And so thank you all so much for listening.